All right, so I'm Paige Shogi. I've been a paramedic for about 8 years, and before that, I did wilderness medicine in the mountains of North Carolina. So I did a lot of first responding up in Ashe County and McDowell and towards Asheville. So bleeding control is something I'm very in love with, because out there, if you didn't stop a bleed, they were going to die before I could get to them.
Because everything is, the hospital's so far away and
Right.
everything else, sure.
Right, and the response time for me
Yeah.
to get to you could be anywhere from 15 to an hour. So if you didn't do something in the meantime, that person's going to die. So when he told me I was teaching a bleeding control class, I was like, oh, okay, that sounds great. I'm excited. And then he told me the group I was presenting in front of, and I'm like, oh, that's a lot of resilience in one room. I was like, that's kind of empowering for me, because I get to see you guys on like the worst day of your life. Like I can only imagine Kent in that situation. And I take care of people. You don't call me to have coffee with me. You know, you call me because you're dying. And I don't get to meet a lot of people that recover, and I get to see them on the other side.
Sorry.
So I was very honored to be able to come meet you guys and just feel the vibe in the room.
Well, usually when there's about a dozen of us, about half lost their limb for accidents or were born that way, and the other half were for medical reasons. So you could have been possibly involved in,
Yeah.
at least a half a dozen of those.
Yeah, and I do deal with that quite often. So
Thank you.
yeah, absolutely. I love what I do. I couldn't imagine doing anything else. All right, so I found this picture and I loved it. It was said, this man is bleeding to death, and this man is running over. He says, I can help. He says, are you a doctor? And he says, no, I'm an artist. So I'm hoping that by the end of this class, you guys will be able to respond in a situation and not be an artist, but you can actually help those people. You know, you're not running up like, I don't know what to do. You can actually intervene. This presentation is based on my experience as a paramedic, what I've seen in the field, what I do on a daily basis. And there's a campaign called Stop the Bleed. And it came into play in like 2015. They were noticing that tourniquet placement was like a last ditch effort to save a life. Everybody thought it was like taboo to put a tourniquet on, because they're like, oh, if you put a tourniquet on somebody, they're gonna lose their limb. If you don't, they're gonna die. So it was like limb over life. And then it was, they may not even have to lose the limb. Like, technology has come so far. Tourniquets are made to preserve the vasculature in your arms and your legs so that you don't have to lose the limb. So Stop the Bleed came in and was like, hey, you don't have to wait. You don't have to be scared for these people. Put on the tourniquet. So I found a lot of their information, and I'm going to reference Stop the Bleed here and there, because I love what they've done. And I just keep hitting the wrong button. So a little bit of like why you're here, like why is this important to me? On a day like today, it's beautiful in New Hanover County. There's a normal population. If you call for an ambulance, you will probably get one in between 6 and 10 minutes. Hopefully a fire truck will arrive in about 5 minutes, because there's more of them than us. And then a cop will be, right there with them. You kind of get everything. We all work together.
Are the firemen here EMSs too?
They are EMTs.
EMT.
Yes, but they are not paramedics, and we work separately, but we love each other equally.
Get that right.
So on a good day, we can get to you in about 5 to 10 minutes. Now, let's think next month when all the tourists come and our population goes up like 5 to 10%, and the roads are clogged and we can't get anywhere. Our response time goes from 5 to 10 to like 9 to 20, and it's insane. And it's simply because there's so many people and there's not enough room. So when it comes to like a traumatic incident, like a trauma-related incident, and someone's bleeding out, that person, if the injury is so severe they could bleed to death in 3 to 5 minutes. Like with no intervention, 3 to 5 minutes. So by the time I get there, there's nothing for me to do, and it's very unfortunate. We do carry blood on the ambulance now, so I can re-infuse you a little bit, you know, but there's not a lot we can do. So you guys being here today, learning about how to put tourniquets on, learning what type of bleeding needs a tourniquet, you know, you are the first responder. You do what I do, but quicker. So just
So I should
remember
never
that.
hike alone.
Yeah, never hike alone. And if you do, carry a tourniquet.
Do you do this in high schools and colleges and because it'd be so important to get this information out to more than just the 5 of us.
Oh, absolutely.
You know,
Stop the Bleed hires a ton of people, and they have a campaign that goes around
That's
and
wonderful.
teaches this.
that's wonderful.
They suggested I do that as well, so it's like, okay. So just a little bit about bleeding, so that you are aware of what kind of bleeding there is. So you have the bleeding that is kind of just oozy. You can put a little pressure on it for about 30 seconds to a minute. It's gonna stop, hopefully, unless you're on a blood thinner, and then it
This
might
one,
take
right?
yes,
Okay.
yes. Her injury on her arm was capillary, and the older you get, the thinner your blood gets, naturally. So you're gonna have to apply a little bit of pressure, and then you're just gonna wrap it. It's a very easy, just capillary bleed. Now, let's talk about your veins. Some people deal with varicose veins, and this is a call I respond to probably twice a week. Someone nicks a varicose vein, and they are pressurized because veins take your blood to the heart. Arteries take it away. So your arteries are pumping, but your veins still have to have some pressure to get it to your heart. So when a varicose vein ruptures, the first thing people want to do is they cover it, and then they want to see if it's still bleeding. About 30 seconds later, is it still bleeding? Yep, it's still bleeding. And they'll do this for an hour. It's still bleeding. It's still bleeding, and they've lost like a liter of blood by this point. I mean, they are bleeding to death, and they don't know it because they keep taking the bandage off to see if it's still bleeding. These types of injuries need to have direct pressure for at least 10 minutes. Don't take it off and try to see if it stopped. 10 minutes direct pressure. If it doesn't stop, like if it's saturating through your bandaging or whatever you're using to hold pressure, then you better start calling 911 and getting more pressure applied on that. And we'll go through all of that. And then,
So an ABS pad with some rolled gauze with
Yes.
some Coban,
yes, that would be
and
perfect.
just put it right on there and
Yeah.
just,
But watch it.
Yeah.
Because it could continue to
Yeah.
bleed. So there's no guarantee it's gonna clot. Like, there's never a guarantee. And then you've got your arterial bleed. And that is when you approach someone and the bleeding has started to pool. Or you can see like a pulsating, that I imagine that's what Kent went through, the pulsation of
I've
the
seen it,
blood.
I've seen it firsthand, yes.
Mhm. So there is, obviously, first reaction, cover it, but it's not gonna do much.
Gotta cut it.
You've got to apply a tourniquet, and that's what, we're here to do. And just a picture of an artery versus a vein. An artery is thick. I mean, it's got a lot of muscle and tissue, so the amount of pressure it takes to push them together, to clot it off, is significant. So, I mean, I've put my entire body on someone to make the bleeding stop because I couldn't apply a tourniquet. It was in a shoulder, and they had clipped the subclavian artery right here, and we couldn't put a tourniquet there. So I packed it, and I put my entire knee in his arm until I got to the hospital. That's how I stopped the bleeding. But that's how much pressure it took to stop an arterial bleed. Yeah, it's a lot. A vein, on the other hand, it's kind of flimsy. You hold that pressure, a good steady pressure, it's gonna stop, hopefully.
Like when they take your blood and wrap you with that hot pink gauze that just
Yeah.
bunches into your elbow.
Yes. And they tell you can take it off in about an hour because hopefully that clot has formed and everything's gonna be fine.
It's still bruised.
So I found it really cute, it's not cute, it's a very precise video on, bleeding control, and it's from a trauma surgeon, and it's just about 2 minutes.
First, make sure it is safe for you to help the injured person. Move the person to safety if you can. Wear gloves and eye protection if they are available to help prevent the spread of HIV and other bloodborne infections. Call 911 if the bleeding appears severe, is spurting from the wound, is from a wound to the neck, the chest, or the abdomen, or does not stop after 10 minutes of direct pressure. Try to stop or control the bleeding until help arrives. Apply steady, direct pressure to the bleeding site with a clean cloth, gauze, or tissue until the bleeding stops. Don't remove the cloth, even if the blood soaks through. If it does soak through, wrap or compress with more bandages and keep the constant direct pressure. For arm and leg wounds, consider applying a tourniquet above the bleeding if it is severe and doesn't stop with direct pressure. Only use a tourniquet if you've been trained to use one correctly. Use only commercially available first aid tourniquets. Do not use improvised tourniquets like handkerchiefs, belts, rope, etc. Only use a tourniquet for severe wounds to limbs to prevent severe blood loss. If you can stop the bleeding at home, gently clean the wound using soap and water. Apply antibiotic ointment to reduce the risk of infection, and cover with a sterile bandage. Don't use alcohol, iodine, or hydrogen peroxide to clean the wound. They can damage tissue. Accidents happen and emergency responders can take time to arrive. Follow these steps and you'll be doing the best you can to stabilize the situation while you wait for help. Thanks for watching. I'm Dr. Reagan Marsh. For more emergency.
So I love that she focuses on remove yourself from the emergency. Okay, so if you are riding down the road, you see a wreck, and there's still cars passing by you, have people help you remove the patient from the side of the road and get everyone out of the road so that you can be safe when you render aid. Because people don't think about that.
I got a question. She said use commercially available tourniquets. So you come to a site situation and there's nothing there but your
I'm gonna
belt.
tell you what to do.
Okay, thank you.
I'm gonna
Because
cover that.
you know,
I know two situations where
I
somebody
was
used a belt.
volunteering in a federal hospital, teaching. And one of my students didn't show up for class. I went upstairs to his dormitory to check on him. He was in the shower screaming. He had a portal and he didn't come out. And I automatically ripped off his t-shirt and I applied the tourniquet. I didn't know how to apply a tourniquet, I just knew from watching TV. And I used the t-shirt and I pulled on it really strong. I got some blood on me. Turns out he was HIV positive and also Hep C positive, but the doctor said I saved his life.
Yeah.
Of course, I had to go through a lot of tests to make sure I didn't get infected, but point is, you know, like, to Bill's question, you know, you see, use the belt.
On TV, use the belt,
Use the
take a
belt.
t-shirt
And
off.
I'm gonna
I
tell
watched
you how.
Emergency, you know, the TV show Emergency, that's what I remember.
Yeah.
And I
We're
will tell you
aging
how to
ourselves.
use the belt appropriately.
Okay,
Because there is a time and a place for it.
because not everybody carries around.
Yeah, that kinda irked me that she said don't, cause,
Well, there is a reason. So, I'll just cover it now. So when someone uses an improvised tourniquet, like a belt, if it's not thick enough, like if they use a small, like thin belt, that belt's going to go into the skin and it's gonna tear the tissue, all right? So there's one problem. Then it's going to tear the vasculature above the wound. So now you could have a second wound on top of the wound you're trying to stop the bleeding from. So if you do have to use something thin, like a shirt, a belt, you simply would put a shirt underneath, like something to protect the skin, and then you apply the belt. So then you create a buffer between the skin and the object, so you don't tear the skin, you don't tear the vasculature. Because that's what ends up causing the amputations in a traumatic incident at some points, because they hurt the vasculature and they can no longer supply the limb with blood.
A thick belt.
A thick, it would do fine.
why?
As long as it is as thick as a tourniquet, as long as it's as wide as a tourniquet, it'll be just fine.
That's all they wear.
It'll be just fine. And if ever you're just improvising, a shirt would be fine.
Go ahead.
It worked, you know? They just don't want you to use something thin.
Okay.
like a shoestring or that,
Or
some
rope.
people use,
Or something
I
like that,
understand
yeah.
yeah, I
No
mean,
rope.
no
Unless
rope,
you
no
have something to
shoestring.
put underneath
Can't
it.
zip tie that boot?
But
Oh, put the shirt first. Yeah,
But really, the
shirt
point is though, if you had something thin and it did cause damage
Mhm.
and it did cause an amputation, that person would still have their life. We're all proof of that.
Oh, yeah,
So,
yeah, amputation's not the end of the world,
well, I'm just saying,
obviously.
you know,
Yeah.
perfect world.
Takes a long time to realize that though.
Mhm. And you don't wanna, if you can avoid having to put someone
Makes
in that
sense.
situation,
Yeah, makes
we're gonna
sense.
try to avoid it. But you're all walking proof
Estimates.
that it's not, it's not the end all be all. So, first things first, you find someone that's bleeding. I brought some gloves with me, so you guys are welcome to take some gloves home with you, to make your own like first aid kit, so that you do have some gloves in your car or in your pocket or whatever, wherever you are, because that actually stops people from helping others very often, because they're like, oh God, what if they have AIDS? And I can't imagine it, because I'm a first responder and it's in my DNA, and if I see someone bleeding, I'm gonna cover it. And if I end up becoming sick and dying, I did what my heart told me to do, okay? But there are other people who are like, oh God, no, I'm not, I don't have gloves, and you know, that person suffers from that. So I am gonna bring you some gloves. So initially, we're gonna apply pressure. As soon as you see the bleeding, apply the pressure. Someone else can come up, hopefully, and help you, say like, hey, grab my wound dressing over there, you know, my 4x4s and my paper, whatever. And they can tear it open for you, and you can replace your hand with some bandaging. But we always want to hold some type of pressure on that wound. We don't ever want to let it go, because then whatever clot you just formed is gone. So the key to all of this is pressure.
And time, I guess.
Yes.
Because, you know, I would think, oh, I wanna check.
Mm-hmm. And it's a natural
So you wanna keep it like 10 minutes, keep the pressure on.
10 minutes, absolutely 10 minutes.
Long time.
Okay, so, wound management, wound care is pretty simple. It either stops or it doesn't. So you can either apply this right here, hold it, hold it, hold it, hold it, hold it, hold it. It's been about 10 minutes, and now I'm gonna wrap it up, and hopefully everything stays in place, they get to the hospital.
And you're gonna leave that
Mhm.
bloody one
Yep.
on there.
Leave it, because
Okay.
it's formed a clot. Like all those clotting factors have went to it, and it's clotted, and now it's stopped.
Okay.
If you take it off, it opens the wound back up. So that's why they tell you not to remove this after the bleeding is stopped. Now, if I put this on here and within like 30 seconds, it's saturated through, it's dripping down my arm, I'm gonna remove it because there's no clot on this. There's no clot to be had. So I'm gonna replace it with like a thicker gauze.
Like an ABS pad.
Like the ABS, yep, the abdominal pad here. And I'm going to just do the same thing, just hold
Sanitary
pressure.
pads work really well.
Oh,
too.
yeah. You
Hate
use what you
saying
got.
that, but, yeah.
You're right.
So we're going to replace it and we're going to try again. All right, we're gonna apply our pressure. And it's probably pretty significant if it was dripping, so go ahead and call 911. Don't forget that part. So extremities, like arms, feet, legs, head, they're pretty easy to wrap up. All right, we just apply some pressure, wrap it up. Where it gets complicated, and especially in my job, is people don't injure their arms and their legs. They injure their groin and their armpits and their chest
Chest
cavities.
wound or-
Yes,
yeah.
like they injure everything but the extremity. So, you have to take gauze. So there is a thing called combat gauze, and it has a hemostatic agent in it that helps the clot form faster. So it burns, it's not comfortable, but it does stop a severe bleed. So you would pack it into that wound, and then you would hold the pressure on top of the packing. The packing alone is not going to stop the bleeding.
So that's a relatively large wound.
Mm-hmm. Yeah, if you can stick your 2 fingers in it, it should be packed. So.
That's what combat medics use.
Mm-hmm. We use it as well.
Oh, you do?
Uh-huh.
Okay.
I brought some with me actually. This is the stuff we carry on the ambulance, and if we get like a gunshot victim or something, I take this and I pack it into the site.
Oh, wow.
And
Oh, so it's all folded instead of rolled?
Mhm.
Oh.
it's
okay.
very, very cool. And there's initially like a powdery substance on it, which is like,
What's the green line in it?
so that is a surgical, what's it called? If they go into surgery, this shows up on the x-ray.
Oh, okay.
So it can't get sewed up inside someone.
Good deal.
Mhm.
Obviously, it's happened before.
It's on all of the pads. That's what those blue lines are for.
That's what it's for.
Mhm. It shows up on an x-ray. There's a word for it, I'll find
At
it.
3 a.m. and you can text us all.
Yes.
Okay.
That blue line's called this. So this is a good example, this wound, it's touchscreen.
So white.
Oh, okay. I don't know what just happened there. All right, so this wound is bleeding pretty heavily. I mean, it's just oozing. You can't do anything with it. You've tried to apply pressure and nothing's working. So you're gonna take your gauze and you're just gonna like shove it in that hole, and then you're gonna hold the pressure. For the fistulas, the ports and stuff like that, sometimes you have to put your actual finger in there and hold pressure. I've had to do that multiple times with different wounds. And I was stuck in that situation until I got to the hospital.
I had a port, but it was in my chest.
Like subclavian, like under here.
Well, I had an infant at the time, so they didn't give me the one that hung out. They gave me the one that was under my skin. And they said it was in a main artery.
They are.
And then they gave me another when I was in ICU.
That's a temporary one.
Yeah, because I kept blowing everything in my arms, so.
Yeah, but all of those devices can bleed. They can shear away, and that's a life-threatening bleed.
Ports always have to go in your arteries.
Mm-hmm.
I mean, I did a PICC line a couple of times, they put it in your side. And actually, so that way they go into the biggest artery you have in your body, which is directly into your heart. So the PICC line actually goes into your heart.
Well, mine was here.
Well, that's.
Like I even have a scar from it.
I had one on my wrist,
Oh, yeah,
you know.
Depends how long you're gonna have it for.
yeah.
Like when you have IV antibiotics,
Yeah.
they blow out veins because they're so strong, especially if it's, a very strong antibiotic, so they usually put a PICC on
This is for a car and everything.
it.
Is that one of us?
No, I thought that was Josie at first too.
Yeah, so did I.
So there are many different types of tourniquets. Everybody thinks they have created the best tourniquet, So the ones we use on the ambulance are called CAT tourniquets. It's just combat application tourniquets. It is touch. They are very easy to apply on a patient and yourself. These are also the type that law enforcement carries, and they'll carry the Special Operation Forces tactical tourniquet as well. It's the same concept. They all do the same thing. They come like this. You put it through the little belt loop. If you're gonna put it on yourself, you put your extremity in it and you tighten it down. And then you bring it around. So,
How do you tighten it up?
so right now it's on there, it's not gonna slide off. So now I'm going to take my windlass and crank it down. And it cranks and it applies the pressure to the artery that you can't physically apply.
The knot, the
Yep.
phlebotomist gives
So
you.
when I was learning about this stuff, watching the TV show Emergency, which you're too young to know about, they would say, you have to open it up again, you can't keep it on.
Right.
It was 50 years ago, things have changed.
Well. So in a extended downtime situation, so let's say in the military, if it's gonna take you 18 hours to get to a hospital, they will open it back up and allow blood flow to go, and then they'll close it. So that is something that is still used today, but we don't use it in like the 911 settings, because it doesn't need to happen.
That's a combat setting. Okay.
Or rural medicine, I had to do it out in the mountains too, so.
Okay.
But yeah, so you just cinch it down and you cinch it down, and this hurts, okay? It is so painful because you are clamping down every vasculature in that person's extremity, but you're saving their life, okay? So once you've clamped it down and you've seen that the bleeding has stopped, you just take your little thing and you hook it in. Whoop! You hook it, and then you cover it.
Oh, so it stays.
Ah, that's pretty nifty.
Yeah, so it's not gonna unlock on you, it's not just gonna
Is that
fall
something
off.
we could buy at CVS?
You can get them on Amazon, and I actually brought two of you can take with you. So. I've got mine off Amazon. I have a jump pack in my car, and it's literally just a sandwich bag, like it's about that big, and it's got like 4 or 5 of these in it, a roll of tape, a pair of shears so I can cut somebody's clothes off, and a tourniquet, and that's all
You say tape, to use cloth tape, adhesive tape, Coban?
we typically, Coban's great.
I've got tons of it. I've got enough wound care to fill this whole table.
We typically use
It reads
fabric
foot
tape.
operations.
That's what the VA
The cloth
likes to
tape,
give out.
Yeah, easy to rip.
I get a reaction to that.
Oh.
Skin reaction.
It pulls my hair out,
Oh,
my
yeah.
skin hair.
There's a trick to that. If you take an alcohol swab and you rub over it, the adhesive goes away, and then you can just peel off your Band-Aid.
You go, girl.
Take an alcohol, like a cotton ball, saturate it with alcohol on either side, and it just comes right off. It'll slide right off. I learned it taking tegaderms off people's arms.
Oh, I can't use Tegaderm, I'm allergic to that, so, yeah.
But yeah, I learned. So, there's the controversy about where the tourniquet goes. Alright, so your military men say high and tight, high and tight. That's how they learned it, that's all there is.
That's
not
a haircut, you
All
know.
there is, yes. So, what they're referring to is if someone gets their foot blown off, they're gonna go all the way up here in the groin, and they're going to go as high as they can and as tight as they can, and they're gonna save that man's life. Yes, they are saving his life.
They're taking his whole leg.
Exactly. But they think that's the only way to do it. Now, medicine's come a long way, and we've learned that if you go about 2 to 3 inches above that wound, you can salvage, what's left, and it stops the bleeding. Now, where it gets tricky is if you have an injury, like right here under the kneecap, you're gonna have to go above the knee, because you can't put anything on a joint, and it has to be at least 2 to 3 inches above that wound. So you're gonna go above the knee about 2 inches. That's the only time it gets tricky. Any other time, if there's an injury down here, if it's above the knee at all, I go to the groin, because I may not get the pressure I need around the calf itself.
Does that apply to like your elbow as well? Okay.
Yep, same idea.
So you do that, you
Mhm.
apply it at the groin. What happens to the leg?
So, if it's within 24 hours, say, they should be able to restore blood flow to the leg. If it's a long-term situation, they have a different
You know what
outcome.
that is.
Yeah. But in a 911 situation, in a civilian situation, it really wouldn't matter. They're gonna save that limb if possible. So yeah, we wrapped it, we wound it up, we secured it, and the last thing is to write a time. This is more for like the military as well, because they need to know how long it's been. But it's not a bad practice to do, just to know, hey, this is when this injury occurred. That's a great time marker for us in the emergency room. Like, this is when this happened. So always just write
What
it down.
happens if there's an extended amount of time between you arriving? Is the time that you secure them?
Yeah, the time you put it on, just write it.
Okay,
And it gives us a good time frame of this injury probably occurred 2 to 3 minutes before this got put on.
okay.
So it's a very precise timeline in their chart, in their history. So, this one's a really cool tourniquet. It stretches and the little diamonds turn into triangles and it adheres to itself. A lot of people in wilderness medicine carry those because they're really small and lightweight. And then this one's a balloon. It like pumps up until the blood circulation goes away.
You keep going, excuse me.
Oh, absolutely.
Keep going.
And I think the last picture, it's a little gruesome, but it's real life. This is something that happens. And what happened was, you know, his legs were crushed, obviously, something happened there. And they applied a tourniquet somewhere like maybe here, and it didn't stop the bleeding. So they had to find a real tourniquet and apply it above that tourniquet. So this happened to me about 3 or 4 years ago at a motorcycle accident. We put the tourniquet pretty high in his groin, but with men you have to be careful, you know, where you put it. And we put it high, but it didn't stop the bleeding. So we put another one even higher, and that worked. So sometimes it does take
Did
two
he lose
tourniquets.
his whole, his
He
entire limb?
wasn't above the knee, amputee, but it was like halfway, I wanna say. But his injuries were incompatible with keeping a leg to begin with. So, he, it was awful. So, he actually came by and met me a few months later. He was conscious, in and out, but he's like, I could just remember you talking to me and telling me, you know, you're saving my life, and it was really nice.
It's kind of like Kent being where he's at today.
Exactly. But this picture, so before like Stop the Bleed came out, a lot of people would just be terrified to apply tourniquets to this man because they're like, oh God, he's gonna lose his extremities, but he's gonna die if you don't. So they use a belt on this leg too. So they ended up having to use a belt, they ended up having to use a tourniquet, and a tourniquet. So you never know how many tourniquets you're gonna need.
So what do? Keep going up the
Mhm.
leg?
Yep, you keep going higher.
When I lost my leg, I was in ICU
Mm-hmm.
after becoming septic after a hernia surgery, and everything shut down, my kidneys, my liver, everything, and they still had my abdomen open because I had abdominal surgery. So when my husband and my sister addressed my leg, they addressed it to the doctor. Her leg is turning blue. And the doctor said her leg is secondary.
Mm-hmm.
She can live without a leg. She can't live without a liver and kidneys and all of that. And so they originally took it above the knee, but I had a bleeding issue. So they disarticulated my knee, and I still had a bleeding issue. So they originally took it below the knee, bleeding issue, disarticulated the knee, continued the bleeding issue, went right above my knee and took me off heparin.
Oh.
Lo and behold, yeah,
Stop the bleeding.
stop the bleeding.
Yeah.
But I am blessed that I have my entire upper limb. I am literally from the top of my knee.
Yeah.
Without having a knee. So
Yeah, his was just above the knee. So.
which is good because, you know, like Debbie, the girl who works for Atlantic Prosthetics that's
Mhm.
normally here, she was in a motorcycle accident and they took a good part of her thigh. And she has problems wearing a
Yeah.
prosthetic because she doesn't have enough limb there.
Ken has the same issue.
Yeah,
Yeah.
Yeah, just saying, when,
Ken's the same way, you ripped her, got their legs ripped off.
Yeah, I've seen over the years, cause I'm 40 years into this
Wow.
rehab, you know, I've seen traumatic injuries that just, you know, there was no way to, you know, no viable tissue to even save enough to get any type of a productive, shall we use the word stump to say, to put into the prosthetic,
Residual
the
limb.
residual limb,
I still say stump.
I still say stump because I'm
I
old.
say stump.
But, you know, so back in the day, you know, they used to be,
What's my nickname?
there used to be
Stumpy.
like
Ain't
lace
never
suction
stumpy.
cups that they
On my
used
car, I have
and
it written, it comes
big
up
belts
stumpy.
on the waist to provide some suction to hold the actual
Yeah.
artificial limb on, so it has come so far. And just the emergency medicine of the whole thing has come so far in saving people's lives and limbs, it's just, it's amazing.
And has a magnet
Mhm.
now, that.
Yeah.
They're gonna switch it around, but
Right.
part of it's on the sleeve, and part of it's
Mhm.
in the prosthetic, and then they're gonna switch it around, I think he said.
Mhm.
Yeah, if you
They're also doing direct bone implants like they do in teeth.
Yeah, I have a
Yeah, but
friend who
they
has
won't do
that.
that on people our age, they will only do that on younger people.
Yeah.
He's had so much problems with
A
that.
lot of infections.
It's an open wound,
Yeah.
Always.
always,
Always.
and he's got infections all the time.
Did we cut you off? I'm sorry.
Oh, no, I'm
Yeah,
here
you
for
could
the
have
party.
seen my
Are
first
you
prosthetic
running from
like in
us, too?
1969.
I would have never
I
known
might
it
as
was
well
called a
have been
residual limb.
carving out of tree limbs.
Like,
Hey,
I knew it as a stump.
Hey, but-
I
And
gotta
that's when
tell you
I'm,
that
when I'm 8 years old and I'm
I'm
trying to be
veteran.
all a kid, you know.
VA and have ox.
Uh-huh.
So the VA sends me boxes of gloves, so I'm not taking any of yours
I got
today.
plenty of gloves.
But not because I don't
Yeah, I
want
do
I
too.
work
The
on
house
cars.
on it, in the car.
Yeah.
Yeah. Always have, I have an emergency bag of ostomy supplies and gloves and
Oh, that's
wound
great.
care in the car at all times, so.
I was
So